9:11 KTRS St. Louis. Today is flying by. You can watch us at stltoday.com/McGraw. You can also watch us at ktrs.com. And, of course, follow us on Facebook and Twitter and the like. Just dropped my pen. Can't talk without my pen. And we send out segments for the show on Facebook and Twitter and everything else. So you can follow along after the show as well. Give a quick shout out. This Burger King mom, the Burger King woman, the mother who left the baby at the Burger King restroom 27 years ago in Pennsylvania. She's now grown up, mother herself. She sent out a Facebook message in the beginning of March she wanted to find her birth mother. She was on with Martin. She ended up finding her birth mother on Monday, met with the birth mother. Now she's going to be back on with Martin, I think, tomorrow. So stick around for that. That should be interesting. 9:12 here, Big 550 KTRS. Well, we're going to try and do something that is very rarely done on radio these days, and that is talk about facts when it comes to the Affordable Care Act. Ryan Barker back by popular demand. You, Ryan, are with the Missouri Foundation for Health, and in terms of full disclosure, you're only here to talk about the facts.
Absolutely. Good morning.
Good morning. So what you say is factual. This is what is actually being done and not being done, and you can fill us in on all the stories.
Yes, sir.
What happens March 31st?
Well, until yesterday, March 31st was officially the end of the open enrollment period for the new health insurance marketplaces. Just yesterday, we did hear that if you have started your application by March 31st, you have until mid-April to finish it.
So they're going to give you 15 more days because
there is such a rush here at the end that I think there is some fear that there will be technical glitches, that people will just have a hard time getting through the call center, getting that in-person assistance. So they're saying if you get started, you have an extra 2 weeks or so to finish up.
So for somebody who has gone to the website, healthcare.gov, has signed up, have they started paying yet, or does it officially start April 1st? How does that work?
Yeah, so it depends on when you bought your insurance in the marketplace. So it's been a rolling start date. So if you bought before the end of December, your insurance started on January 1. So we have people that are paying their insurance premiums. Now healthcare.gov is working to the point where they're actually, when you get to the end and you pick a plan, you can hit the Pay Now button and pay your first month's premium.
Gotcha. Okay, so there are people already going to the doctor and using the insurance card that they get along with this new plan.
Yes.
Okay. There was a story, one of the reasons why we wanted you on here was there was a story in the newspaper the other day about cancer doctors, and we're starting to find out that there are many cancer doctors that are not on these plans. What was that story about?
Yeah, so one of the things when you create a new insurance marketplace or you create new plans is that it's a balancing act between cost and access to providers. And so one of the ways that the insurance companies held down some of the costs for these marketplace plans was to limit the provider networks. So there is a lot of concern. We've seen a couple news stories, and it's not just in Missouri, it's nationally, of some of these insurance plans that have limited access, especially to those specialty cancer centers. This is at the top of the administration's list. They are saying once we get through open enrollment, they are starting to plan for next year. They're taking bids from insurance companies to continue to be part of the marketplace or to join the marketplace. And one of the things they are looking at is network adequacy and making sure that there is access to the right type of providers and that the right providers are part of these plans.
Is it a situation where now it's two-tier? If I want somebody from the Siteman Cancer Center and it's not on my plan, I've got to buy a more expensive plan? If I want the best, I'm going to have to pay for the best?
We're already seeing that in the marketplace. So in Missouri's marketplace in the St. Louis area, there's 23 plan choices. And the ones that are a little bit more expensive have a better open provider network. So if you want to include BJC, then you have to pick, it's a certain Coventry plan. So some of the Coventry plans don't include BJC. All of the Anthem plans don't include BJC. So it really does depend. If you want a really wide provider network and to pretty much go wherever you want to go, you're going to have to pay a little bit more for that.
And so you should check the plan to see which doctor, and if you want to keep your doctor, then you better check the plan. And if your doctor is not on the plan, it might have to cost you a little more. Right.
And that is one of the things that we are really encouraging consumers. Some people are sophisticated enough to try to figure that out if their provider is part of the plan or not. A lot of people need help. And so there are these navigators, certified application counselors out there, and they have been doing this for almost 6 months now, and they can help you figure out if your provider is part of one of these plans.
Recently, the Missouri has decided to forego setting up their own state exchange and went with the national plan. How many people and how is the sign-up going? Are they going to reach their budget? What are those numbers?
Yeah, so at the end of February, and we expect a very big March, but at the end of February, those are the numbers we know. We have 75,000 Missourians that have signed up into the marketplace. We know there was a lot of concern about, are we going to get young people? About 32% are under the age of 35. So we are doing fine in terms of young people. The goal that the feds have set for Missouri is 127,000 enrolled in our marketplace. I don't know if we'll hit the goal, but we're going to come awfully close.
What happens come now April 15th if you don't have insurance and you don't sign up for insurance? What happens then?
So the simple answer is if you do not have insurance, if you haven't signed up by April 15th, then you're going to pay a penalty for not having insurance in 2014. And that penalty is either $95 per adult in the household and $47.50 per kid, or 1% of your income, whichever is higher.
Okay. And then let's say I want to sign up April 20th. Am I allowed to sign up April 20th?
No. Well, no is the easy answer. The next open enrollment period will not be until November 15th of 2014. The only exception to that is if you have, just like insurance works with an employer, if you have a life change event, you have a baby, you get married, you turn 26 and fall off your parents' plan.
You get fired.
Right.
Okay.
There will be what is called a special enrollment period for you as an individual, but you have to have one of those qualifying life events in order to enroll when there isn't open enrollment.
And if I don't, and I just choose not to, or I miss it, or for whatever reason I'm not taking my own personal responsibility in signing up for my own health insurance, I have to wait until November to buy insurance again.
That's right.
So if I get sick in June and I don't have insurance, what happens?
You're like hundreds of thousands of other Missourians that are currently uninsured. There is clinics that people can go to that are sliding scale, who do not have access to health insurance. And then, you can walk in the ER and they can't turn you away.
Right.
But you're going to have a lot of medical bills and medical debt. And we know about 25% of Missourians and 25% of Americans really struggle with having medical debt, medical bills that they can't pay.
Ryan Barker is our guest. He's with the Missouri Foundation for Health. Quickly, what is the Missouri Foundation for Health, people who don't understand?
Yeah, so we are a philanthropic organization. We have an endowment. We do not fundraise, and we are required by law to give away about 5% of those dollars a year in grants. So over the last 10 years, we've given out about $500 million in grants across the state of Missouri.
And who are you? Who gave you the lump sum to start it all off with?
Yeah, it comes from, so we're what's called a conversion foundation. So Blue Cross Blue Shield Health Insurance Company used to be nonprofit, and they converted and became for-profit. And the law says that when you make that conversion to for-profit, you can't take your assets with you. So those assets spun off and created us. We're completely independent from the insurance company. We're our own separate entity, but that's where our money comes from.
Gotcha. Yesterday on the show, I pulled off this clip. We talked about this, and a caller called up, and I had them pull the caller because the caller talked about his daughter who had signed up for the Affordable Care Act. Can you play that? We're going to play the caller. Here's the caller. I want Ryan to respond to this caller from yesterday. Hello, Eddie. You're on the air.
Yes, my 26-year-old daughter took a job in Poplar Bluff.
You're how old is she?
26.
26. Okay.
She lost her job, got laid off, signed up for Obamacare, $79 a month. She got a subsidy.
Mm-hmm.
And now she lost her doctor. She believes she was going to be able to keep him. She can't find a doctor down there that'll take it except for one. And he wants her to pay everything up front and for her to try to get reimbursed by the government because he's having problems getting paid on the Obamacare. So she's driving all the way to St. Louis, spending $75 in gas to come up here to see a doctor. So now she's going to drop it and look for something else. She said, I definitely got to get something else. I ain't spending $75 in gas to drive all the way to St. Louis to see a doctor.
Okay. What's going on there?
Okay, so a couple things. So one, yes, there are issues with provider networks, although I would say part of this issue is with the insurance company, not with the marketplace. So if you are purchasing insurance, then that insurance company is responsible for having a network of providers that are taking that insurance.
Okay.
This is private insurance in the marketplace. We have heard that there are some issues. There were so many people that enrolled in December that at first it was problems with the healthcare.gov, and now what we saw in the first few months of the year, although it's starting to get better, is that all those people then went to go use their insurance. And what a provider's office does is there is a national, or there is a state database where they can go in and check and make sure that your insurance is active.
Mm-hmm.
There were so many people that signed up that the insurance companies are backlogged verifying insurance. So front office staff at a doctor's office were having to call and get on hold for forever to verify that this person actually had paid their premium and had active insurance. So that could be part of what the provider's office is saying. The patient should not have to pay up front, but it could be about verifying the insurance is active. What we have been encouraging consumers to do is when they pay that first month's premium, whether it's online or they get a bill and they send in a check, is to bring a copy of that first month's payment, because that's what the doctor's office really wants to know, is that you are active, you've paid your first month's premium, and then they know that they're going to get reimbursed from the insurance company eventually.
So once you prove to the doctor, yes, here's my network, here's my insurance, and I paid, therefore I'm good to go, it's having a receipt when you go bring something back to the store.
Right. So a lot of providers, I think, are nervous that people haven't paid their premium. They're having a hard time verifying these patients. This is like a snake that swallowed a big mouse, and it's just making its way through the process. We had a lot of upfront glitches, and now it's just getting these people verified through the insurance company.
Ryan Barker is our guest. He's just the facts. He's with the Missouri Foundation for Health. Questions, comments about the Affordable Care Act, a lot more to get to, including the fact that Missouri is turning down federal funds to insure its residents or its citizens. We'll come back and talk more about that. 924, Big 550, KTRS. Ryan Barker is our guest. He's with the Missouri Foundation for Health, and he's just the facts when it comes to the Affordable Care Act. Ryan Barker, our guest. We have a couple of questions. We'll take them right now. Amy, thanks for holding on. You are on the Big 550 KTRS. Amy, are you there?
I'm here. Sorry about that. Sometimes I can't hear when I'm.
That's all right.
But anyway, I have a couple questions. I'm trying to help my sister, her husband, and she are going through the same situation with trying to get private insurance. And they had a plan last year that they got that letter saying that plan wasn't good anymore and they were going to have to change. So they went to a broker to get new insurance, and they were all set up. They paid 2 months of premium, about $900 a month with United Healthcare. I think it's Blue Cross Blue Shield Anthem PPO. Looks just like a normal insurance card, but it's a pathway. And now she's getting calls from her doctor saying that they didn't take that insurance, and she's going to have to pay, everything up front.
Amy,
I guess it's an exchange.
Amy,
and if you could explain that a little bit better.
Amy, thanks for the phone call. Ryan, go ahead.
Yeah, so it sounds like if it's Anthem and it's a pathway plan, that she probably, through that broker, purchased a marketplace or an exchange, same thing, a marketplace plan. This is one of the frustrating things is we've been talking about the provider network and how important it is to know up front, if you have a provider that you've been using and know and like, making sure they're part of that network before you purchase that insurance. Unfortunately, at this point, the choices are pay up front to this provider, out of pocket, out of network, or find a new provider that takes the insurance, or they will be able to switch to a different marketplace plan come November 15th. But at this point, that insurance...
Do you need a insurance broker anymore because of this?
You don't necessarily. You can figure it out on your own, or you can get help from these navigators or certified application counselors who are trained and licensed and certified to do this. The brokers can work in the marketplace, and they actually get paid on the back end to sell marketplace plans. But the consumers that are the navigators that are out there doing this are very aware that consumers need help with the provider network stuff. And we do have brokers and agents that are part of our coalition, and I think it really just depends on the person. Some of them are really good about helping them through those questions of provider networks, and others aren't.
So you're saying that this caller or the sister bought the wrong network?
Yeah.
Because whatever doctors they needed wasn't on the network they were buying.
Yeah, she should have. And, our navigators ask that question of, do you currently have a doctor that you go to that you like? Let's make sure they're in the network before you purchase.
$900 seems like an awful lot of money.
It does. It would depend on the family size and the income. So if it's a family of 4, it seems a little high. But
right. Yeah. All right, let's go to Tim is online too. Tim, you're on KTRS. Oh, hold on a second, Tim. I got to put you back on hold. Now let's try this. Tim, are you there?
Hello?
Hi, Tim. You're on the Big 550 KTRS.
Yeah, so I currently am 26 and I have insurance with my employer, but I'm going to be graduating college here in May, and I'm looking at some other jobs that currently don't offer any insurance. So would I need to sign up for this marketplace thing now for when I anticipate on not having insurance, like in the summer?
Great question.
Great question.
Thanks, Tim.
Perfect question for what we were talking about earlier with these special enrollment periods. So if you leave your current employer and lose that employer's insurance and you get a new job that doesn't offer insurance, at that point when you have that job change, you will be eligible for a special enrollment period, and you'll be able to enroll in the marketplace at that point.
Recently, the state of Missouri, senators stood up on the floor and said, we are turning down federal funds to expand Medicaid. What does that mean exactly?
Yeah, so one of the components of the Affordable Care Act to really make insurance accessible for all Missourians, all Americans, was a Medicaid expansion up to about $15,000 for a family of 2. So what happened was the Supreme Court ruled Medicaid expansion is now optional, and so every state is deciding for itself whether to expand its program. So what we heard this week was 5 senators got up on the House floor and said this isn't happening. What results from that is that we have our current Medicaid current Medicaid program, which is pretty low eligibility, and then there's a gap. It creates a coverage gap where the lowest wage Missourians don't have access to Medicaid, and the marketplace, you can't get financial assistance until you get over the poverty level. So we're leaving this gap for people under the poverty level, don't have access to the marketplace, and because we may not expand Medicaid, they don't have access to Medicaid either. So we're essentially leaving those people uninsured.
So what you're saying is that in Missouri, since we're turning down this federal funds, in which other states are taking, basically, there are people out there who make too little amount of money to be subsidized.
Yes, because the way the Affordable Care Act worked originally, where every state had to expand Medicaid, up to a certain income, you had Medicaid, and then above that, you got a sliding scale of financial assistance in the marketplace. Well, when they made Medicaid expansion optional, it sort of left the lowest wage workers out in the cold, where they often either aren't offered employer insurance or they can't afford it, and now they don't have access to Medicaid either. We're not talking about high-income families.
Sure.
I mean, we're talking about minimum wage workers.
So if you're out there and you don't make enough to buy insurance through healthcare.gov, you can't buy health insurance,
right?
Because you don't have the money for it. You get sick. What happens to you?
Yeah. Once again, we are trying, because we're coming across these individuals that fall into this coverage gap, and it's heartbreaking. Our navigators and certified application counsels are out there, and they're meeting these people every day, and we are trying our best to connect them to primary care. So there are safety net clinics throughout the state that see patients on a sliding scale. But that's primary care. And then, it's if you need specialty care or hospital care, they can get you in, but oftentimes if you're uninsured, you're going to be left with those medical bills.
Kit Bond and hospitals are saying that because of this expanded Medicaid, or care, I guess, and the federal government is no longer reimbursing hospitals for indigent care. So that money's going away. We're not taking this federal funds to insure these people in this gap. So there are rural hospitals who are saying, we will close if we do not have this money. Are they playing chicken? Are they what's going on there?
No. So part of the Affordable Care Act cut some of those charity care dollars for hospitals, and they cut it about 75%, with the assumption that more people would have insurance, and so we wouldn't need all these charity dollars. Those are still being cut. And so what happens is the hospitals are still going to see a pretty high level of uninsured because we're not expanding Medicaid, and they're not going to get the charity care dollars to offset those costs. The major health systems, BJC, they're going to survive. They're going to find a way. They're going to take a hit. It's the rural hospitals that we're most concerned about. And what I've heard directly from the mouths of some hospital CEOs in rural Missouri is they won't necessarily close their hospital. They will close their emergency room. So in Salem Memorial District Hospital in Salem, Missouri, the CEO told me, I won't close my hospital, but I'm losing about $1 million in this charity care. I'm going to have to close my ER. Next closest ER is Rolla, 30 miles away. It's going to have an impact on patient care. We have one hospital at Lake of the Ozarks, Lake Regional. They're barely holding on right now. Do we really want a major tourist attraction? A lot of people go there in the summers with no emergency room. So we're seeing it in other states already. So Georgia and Mississippi, their rural hospitals have started to really take financial hits. And it's such politics that in those two states, their legislature has put state revenue dollars into saving those rural hospitals when they could have just expanded Medicaid and been using federal dollars to do the same
So they're
thing.
using state money to keep open rural hospitals because they rejected federal money to keep rural hospitals open.
Yes.
In the state of Missouri, is there a law that says, Ryan Barker, that state officials are not allowed to tell Missourians how to get health insurance?
Yes. So our legislature put a proposition on the ballot in November of 2012. It was called Proposition E. And one of the things it did was ban the governor from setting up a state-based marketplace. But the other thing it did was limit the ability of any state employee or state agency from talking about doing anything related to the marketplace. So in other states, a lot of consumers want information on insurance. They go to the Department of Insurance. In Missouri, if you do that, there's nothing on the Department of Insurance's website about these new marketplaces.
So if you were an elected official or worked for the state of Missouri, you would be breaking the law coming on this show and doing exactly what it is you're saying.
Yes.
That's Ryan Barker. Hold that thought. We'll come back, take more calls. Tim, Steve, Mick, hold on. That's all coming straight up. Hey, how's your Ryan Barker's been our guest. He's with the Missouri Foundation for Health, and he's been our fax man all along, and we appreciate him coming and spending time taking phone calls and answering questions because your elected officials are not allowed to do this. Steve, on line 3, you're on KTRS Radio.
Yes, I have a question about the fines. Are you going to how you impose these fines? Are these fines going to be are you going to garnish wages? Are you going to put liens on houses? And another question, where are these fines going? Are they going back into the system to help the system or to help some politician out?
Yeah, great question. So 2 things. One, where will the fines be collected?
Well, first of all, we say you and the Missouri Health Foundation.
Yeah, I'm not the government.
You and your organization are not finding anybody.
No, we're not finding anybody. We're a nonprofit. So the government will be collecting the fines. It's actually the IRS. And this is one of those myths that is out there that people can get wages garnished or their home, foreclosed on. So actually, the way it's going to work is if you get a tax return, if you get a tax refund on your taxes, they can take the penalty out of your tax refund. But the Affordable Care Act doesn't actually give the IRS much teeth in collecting these penalties. So if you don't owe any taxes, or if you're not owed a refund, they can send you a bill, but they can't come after you. So it doesn't give the IRS a lot of tools to come after people. So absolutely no, they cannot garnish your wages. They cannot come after your house or your car. It doesn't happen.
But the fines will go up year after year if you continue not to get insurance.
Yes. So and the easiest way to think about it is this first year it's 1% of family income. Next year it's 2%, then it goes up to 2.5%, and then it's adjusted for inflation after that.
And the idea is they want to incentivize you or deter you from not getting insurance because according to the charts, you make enough money, you should be forced to buy your own health insurance. We as a society should not be forced to pay for, you should not be getting free bad health care from the emergency room. You should pay for your own preventative care.
Just like we have, there's a law in Missouri that everybody is supposed to have car insurance. You take care of yourself. If you're in an accident, the taxpayers aren't going to cover your bill of repairing your car. You can think about health insurance in the same way. Now, the second part of his question was where does the fine go? There is a special fund. So if you are penalized because you don't have health insurance, it goes back into a fund that helps. It's to help pay for the financial assistance that people are getting in the marketplace. So it does go back. It's not going in any special anything, but it does go back towards the law and helping pay for aspects of the law.
Let's go to Mick. Mick, thanks for holding on. You're on KTRS Radio.
Good morning, gentlemen.
Morning.
I've had union insurance all my life. Last year, forced to buy my own. Bought a policy. 2 months later, said it was no longer compatible or no longer met the requirements of the Affordable Care Act. Bought another plan. Had to use the insurance. Received a bill from the hospital. No insurance on that bill. Told them I had insurance. I got a bill for a larger amount from the hospital. So is that just, my deductible part that I'm paying? Nobody could really explain it. And then when we went to the healthcare marketplace to try to find other plans that might be comparable or less expensive, we found no alternative other than the plan we were already with Anthem Blue Cross Blue Shield. There were lots of Anthem Blue Cross Blue Shield plans, but there was none from Coventry or GHP or any other provider. What about that?
So if you go to the marketplace here in actually anywhere in Missouri, there are plans from both Anthem and Coventry. So there are two insurance companies that are offering plans, and everybody that goes into the marketplace is offered the same plans. The costs may be different depending on your situation, but there are two insurance companies.
Did you buy your insurance through healthcare.gov?
Well, no, because we already had a policy through Anthem Blue Cross Blue Shield.
Right.
So if your hospital bill went up after they billed your insurance, it could be your deductible. I mean, there's so many, it depends on your personal situation. It could be the deductible. I also would say that I had a friend that just went through this, and he went back and questioned the insurance company, and they re-looked at his bill, and they had made a mistake, and they cut the bill. The bill ended up being cut in almost half. So if you think there's something weird going on, insurance companies make mistakes, and you should question that and make sure the bill is correct.
When you get a letter saying that your insurance is no longer acceptable, is there a I understand there are reasons, but is there one reason that is more than other reasons? Like, what's the reason most of these insurance policies are no longer acceptable?
Yeah, so the insurance policies that got canceled were mostly, all of them were insurance policies that individuals or families had purchased on their own in the individual market. The main reason that those insurance policies were canceled is over half of the insurance policies sold to individuals. When you went to use healthcare services, that insurance covered less than half of the bill. And the new rule is that insurance has to cover at least 60% of the bill when you use healthcare. So a lot of the plans in the individual market weren't very high quality plans. You were paying for something and then maybe it paid half the bill when you actually use the insurance. The new rule is that that insurance has to cover, the minimum is 60% of the bill.
So a lot of people were told, hey, your car is being recalled, and everyone said, I like my car, it's fine, it's nice and cheap, but they didn't realize that their car didn't have any brakes.
Right. So, and a lot of people, if you hadn't used healthcare, if you hadn't been in the hospital, you may not have realized that your insurance wasn't, all that high of quality. The problem was that, you never know when you're going to end up in a car accident or end up where you need that insurance. And then a lot of people are surprised that, hey, I had cheap insurance, I liked it. Well, yeah, and then when I used it, it didn't cover much of the bill.
Ryan Barker, websites for people to find out more information for you and through your organization.
Yeah, so we have a website that is just factual information, covermissouri.org. You can find events in your local community where you can find information, get enrollment assistance. There also is a zip code locator where we have navigators, certified application counselors. We even have some insurance agents and brokers that work in the marketplace. Put in your zip code, put in your county, and you can find people near you to help you figure out this process of healthcare.gov.
I have got about 30 seconds. What's the biggest misconception about the Affordable Care Act?
Ooh, biggest misconception. So, lately it has been people who are on Medicare over age 65. I have a lot of seniors that are really worried that they have to do something with this marketplace. And so I've been telling people, Medicare is not impacted with this marketplace. You don't have to do anything. You're good to go.
There you go. Ryan, thank you very much.
Absolutely. Thank you for having me.
9:52 here, Big 550 KT.